Okay, good evening, students. We are coming to learn about Aqueous Humour today. Aqueous Humour. Aqueous Humour. So, from the previous class, you realize that this is the cornea and its layers. And this area is the anterior chamber of the eyeball is occupied by what? The aqueous humor. Alright, so look at this particular picture. You realize that the aqueous humor occupies certain significant portions of the eyeball. It is found at the posterior chamber, okay, here. It's also found within the pupil. It's found within the anterior chamber as well as the anterior chamber angle, also known as what? The iridocorneal angle. We say iridocorneal angle because it is formed between the cornea and the iris. So iridocorneal angle. So these are the areas where the aqueous humor is found. Okay. So let us start with certain facts. What is aqueous humor at all? It is a fluid which is found within the eyeball in the locations which I have indicated. The purpose of this fluid is to help give nutrition or nourishment to avascular structures that are found in the eyeball. Okay. Alright, so how much aqueous do we have in the eye? The total quantity is 0.30 mils. 0.30 mils. So this is the breakdown. Within the anterior chamber, the quantity is 0.25 mils, whereas within the posterior chamber, the quantity is 0.05 mils. So in total, you have 0.30 mils. Okay. The rate of production of the humor is 3 microliters per minute. 3 microliters per minute. For your information, 1 million microliters is equal to 1 liter. So when I talk about 3 microliters, what it means is that if you have 1 million units of aqueous humor, 3 of them makes what? 3 microliters. Alright, so let's talk about functions of the aqueous humor. Why should the aqueous humor be there? What are the functions? For your information, it keeps the eyeball intact. It gives structure, okay, and maintains the volume of the eyeball and also provides intraocular pressure. So it maintains the structure and volume of the eyeball and also maintains intraocular pressure. Alright, so that's what the aqueous humor does. Number 2, it gives nutrition to the avascular ocular structures. Okay, it gives nutrition to the avascular ocular structures. So for example, the crystalline lens here is avascular, so the aqueous humor gives nutrition to it. Alright, again, look at the posterior surface of the cornea. Alright, posterior half of the cornea is nourished by the aqueous humor. Okay, so that is it. It is also important to know that it gives nourishment to the trabecular meshwork, okay, or the structures which are found at the iridocorneal angle. The third and the last, but not the least, but before that, remember, apart from giving nutrition to the avascular structures in the eye, after metabolism, these structures, their waste products are also taken by the aqueous humor and drained away to the venous system. Okay, all right. So the third and the last but not the least function is to have what? Optical robe. What does it mean when I talk about optical robe? Remember that 99.9% of aqueous humor is water. It doesn't have red blood cells. It doesn't have any opacification within it. So it helps in light transmission and focusing onto the retina. Okay, that is what I mean by optical rule. Okay, so let's talk about its formation and outflow. Okay, its formation and outflow. There are three major mechanisms that help in aqueous humor formation. Before that, remember that there is a barrier known as the blood aqueous barrier. All the aqueous humor that we have, it comes from blood. Okay, so blood aqueous barrier. Okay, so what happens at the blood aqueous barrier? One of the main components of the blood aqueous barrier is what the ciliary body. This is the ciliary body. Okay, so it has epithelium. So at the level of the epithelium, three main events occur there. One, we have active transport or active secretion of aqueous. And this active secretion of aqueous is by the non-pigmented ciliary epithelium, and that is about 90% of production. So this is a ciliary epithelium. Okay, so this is the pigmented area, and below is the non-pigmented. So 90% of aqueous humor is secreted by the non-pigmented ciliary epithelium. Okay, the other 10%, the mechanisms include ultrafiltration and diffusion. When I talk about ultrafiltration, ladies and gentlemen, what it means is that when blood reaches the blood aqueous barrier, okay, there's like a sieve which is able to sieve all the water content from blood and release it onto the posterior chamber. It releases the water which has been brought or passed through the blood aqueous barrier through those sieves. Okay, it gets water and the water comes and accumulates itself at the posterior chamber. But hey, apart from water filtration, the third and the last but not the least method of formation of aqueous is called diffusion. What do I mean by diffusion? Diffusion is the method through which solutes like the minerals that we know about, okay, electrolyte like sodium, potassium, chloride, and all other solutes, glucose, which come from the blood, okay, they are deposited within the aqueous humor to act as what source of nourishment to the avascular structures. So three major mechanisms: active secretion, ultrafiltration, and what diffusion. Okay. Now, for outflow mechanism of aqueous, there are three major ones. Okay. We have the conventional method, which is also known as the dependent method, and that transports about 90% of the aqueous humor. Okay. Yes. Then we have the non-conventional method, also known as what the uveoscleral method, which conveys 10% of the aqueous. Then the third but not the least are others, whereby microcosm of aqueous humor passes through what? The iris veins, also the retinal veins, and also through the cornea. Now let's focus our attention on the conventional method. How does it happen? Okay, so once aqueous humor is produced at the posterior chamber, it enters through the pupil, reaches the anterior chamber. Okay, after it has reached the anterior chamber, it goes through the iridocorneal angle, but specifically, it goes through trabecular meshwork. From trabecular meshwork, it enters through Schlemm's canal. From Schlemm's canal, it enters through what? The scleral spur. From scleral spur, some of it may go through the ciliary body band. And from the ciliary body band, aqueous humor passes through the episcleral veins. From the episcleral veins, some of it enter through superior ophthalmic vein, others go through the inferior ophthalmic vein, ending at the cavernous sinus, where they are drained through the jugular veins and other bigger veins into the systemic circulation. So that's the conventional method, and that is what pressure dependent. What do I mean by pressure dependent? If the intraocular pressure in the eye is high, then this conventional method increases its outflow. But if the intraocular pressure is low, it decreases its outflow. But the uveoscleral method of drainage is not dependent on the intraocular pressure buildup. Uveoscleral, because some of it may pass through what? The ciliary body, the iris, and go through the sclera, and of course the suprachoroidal space, and end up in what? The vortex veins. Let me repeat. The uveoscleral method, what does it entail? Some of the aqueous will go through the iris and be absorbed through the iris veins. Some go to the ciliary body. Some also pass through the suprachoroidal space and get absorbed within the vortex veins through which they are drained. Okay? Okay. Having spoken about how it is produced, how it is drained, let us talk about, I told you that it maintains the intraocular pressure. Okay? So, let us talk about certain variations that may occur in intraocular pressure so far as production of aqueous humor is what? Concerned. So, we have long-term variations and of course short-term fluctuations. Among the long-term variations, what can we talk about? Age. The older we are, the higher the risk of getting hypertension. And when we have high blood pressure, at the level of the blood aqueous barrier, the level of ultrafiltration and diffusion will be higher. There will be more production of aqueous, and that will increase intraocular pressure. So that is age for you. Another variation that may come with it is what? Blood pressure, as I've explained. If you are even young and you have high blood pressure, because your blood pressure is high, the pressure at the level of the blood aqueous barrier is what? At this area also is what? High. And once it is high, there will be increased ultrafiltration and diffusion, increasing aqueous humor production, and of course increase in what? Intraocular pressure. And this method is what? Non-dependent on the existing intraocular pressure. So you are prone to having increased pressure in the eye. Another variation that may occur is what? Body weight. We are talking about those with high body mass index. It means obesity. When you are obese, the orbital fat may be what? More. And this increased orbital fat may compress the orbital walls and invariably also bring about what? Pressure on the concentric layers of the eyeball. Okay, look at the sclera here, the uvea, and once the orbital fat is increased, it presses the concentric layers of the eyeball, increasing what? Intraocular pressure, because the aqueous humor becomes what? Relatively more. Now let's talk about other things. Gender. Aqueous humor production may be more in males than in females. Why? Because males have more risk factors of becoming what? Hypertensive. Okay, that is it. Let's talk about climate. Climate. It has been found out that in winter, intraocular pressure may what? Increase. Why? Let me tell you the reason. Than in summer. The reason is the following. Look at the episcleral venous veins here. Alright? It is known that cold temperatures bring about vasoconstriction. And now If there's winter, these vessels may constrict and impede further passage of aqueous humor. So, because there could be vasoconstriction here, the normal pressure in these veins is generally 12 millimeters of mercury. When they become constricted, the pressure increases, and this has impacts on the other channels through which the aqueous needs to pass. Okay, so invariably the pressure will increase in the eye. Again, let's talk about in the morning as against the rest of the periods of the day. In the mornings, temperatures are lower, and this may lead to what? Vasoconstriction. So in the mornings, pressures may be higher than what? In the evenings or other parts of the day. Now let's talk about short-term fluctuations in aqueous humor. Short-term fluctuations in aqueous humor. Okay? For example, when there is central venous pressure increase, okay, there is the tendency that aqueous humor may what? Increase. For example, if someone has varicose veins in any part of the body, okay, apart from that, people who may have maybe pregnancy at end stages, okay, in their 35 weeks, 34 weeks, or people who have fibroids, if there's compression on the vena cava, this may induce increased pressure in what? In the eye. So, central venous pressure. Let's talk about change in body position. Change in body position. Okay. Now, if you are sitting down in comparison with someone who is lying down, in sitting down position, because the eyeballs are up and the rest of the body is down, the pressure is relatively lower in the eye. But if you are lying down in supine position, the pressure is relatively higher than somebody who is what? Sitting down, because there's even distribution of what? Your body fluids, and that you may have more in the eye. Whereas when you are sitting down, the eyeballs are in independent position, so the pressure in it is what? Less. Let's talk about two positions when we are lying down. Supine position as opposed to prone position. In supine position, the eyeballs are found in independent position, so the pressure is lesser than if you are lying in prone position. In prone position, the eyeballs are found in dependent position, so the intraocular pressure is what? Higher. Again, in lateral decubitus position, the eyeball which is dependent here means the one which is found in lower position may have what? Increased intraocular pressure in comparison with the one which is not in dependent position. So let's talk about diurnal variation of intraocular pressure. There's more increase in the morning than in the evening. Apart from talking about the cold temperature which may bring about vasoconstriction in the episcleral veins in the mornings, remember that in the mornings pressures may be higher than other times of the day, because remember that there is endogenous secretion of cortisol and catecholamines. These may increase up to around 11:30 thereabouts in the morning, and when they are increased, they have impact in how aqueous humor production increases, and therefore intraocular pressure increases more in the mornings than in the evenings, so, or the rest of the day. But the variation should not be more than 4 millimeters of mercury, because if it's more than 4 millimeters of mercury, it means that most likely it is what? Pathological increase. Another fluctuation that may bring about changes in intraocular pressure is eye movement. If you keep moving your eye in all directions, left, right, center, up, down, you are subjecting your eye to increased pressure. Okay, so apart from that, other body positions. If you are doing an exercise in which the head has to be down and the feet or the legs have to be up, now the eyes have gone into a dependent position, so the intraocular pressure will what? Increase. Let's talk about exercise. In exercise, okay, there's decrease in what? Intraocular pressure. Okay, so this is related with what? Metabolic acidosis, and this bring about changes, okay, within the trabecular meshwork and at the level of the blood aqueous barrier. But in general, exercise brings about decrease in intraocular pressure. Pharmacologically, there are medicines that constrict the pupil and others dilate the pupil. Those who constrict the pupil are known as what? Myotics. Myotics bring about what? Decrease intraocular pressure. Why? Because myotics will constrict the pupil. That means they will draw the iris concentrically or towards the center and open avenues at the level of the iridocorneal angle for aqueous to drain away. Okay, look at it here. As I said, it comes from posterior chamber through the pupil here. All right, anterior chamber is here and pass through the iridocorneal angle and comes through the episcleral veins. What you see here, that is where the episcleral veins are found. So pharmacologic agents which constrict the pupil will open up the iridocorneal angle here, all right, and let more aqueous go away. But we also have mydriatics. What are mydriatics? They dilate the pupil. What it means is that the iris is drawn towards the periphery. It closes the iridocorneal angle further, decreasing the outflow of aqueous. What it means is that the intraocular pressure will increase with the use of what? Mydriatics or mydriatics. Having spoken about that, now let's talk about few other things that are important. What are the composition? What chemical components are found within the aqueous humor? Alright, as I said, 99.9%. Some books talk about 98% of the aqueous humor. Others talk about 99.9% is made up of what? Water. And the rest 0.01% is made up of other substances. What are they? These include inorganic ions and organic anions, carbohydrates, glutathione and urea, proteins, growth modulating factors, oxygen and carbon dioxide. So, without these substances I've mentioned, no tissue survives. And we are talking about structures that are avascular and nourished by the aqueous humor. So, logically, the aqueous humor should be rich in substances that should potentiate it to give nourishment to the avascular structures we have already spoken about. Let's talk about what inorganic ions are. As previously spoken about in our previous class, the precorneal telephone, okay? Inorganic ions are sodium, potassium, magnesium, copper, all those, right, are inorganic ions that the aqueous humor is what? Rich in. As we gave the lecture on precorneal telephone, is about the same constituents, right? So, now let's talk about organic anions. Notable among substances under organic anions are chloride, bicarbonate, lactate, and what? Ascorbate. Right? So those are organic anions that the aqueous humor is rich in. Carbohydrates. Which carbohydrate are we talking about? Basically, it's glucose. Okay? It's glucose. Carbohydrate will break down and finally turn into glucose. But the blood aqueous barrier, it is a barrier which regulates what passes there. So glucose has smaller molecules than carbohydrates. So the carbohydrate I'm talking about is in form of what? Glucose that passes through the blood aqueous barrier to be part of the what? Aqueous humor. Let's talk about glutathione. Glutathione. What does it do? Glutathione is a substance which arrests apoptosis. Okay, so if your aqueous humor is rich in glutathione, it means that you might not easily develop cataracts. You might not easily develop corneal opacity because it will arrest programmed cell death and make these substances more vital and viable. What is the function of urea? Urea is able to decrease the amount of intraocular pressure or the amount of aqueous humor if there is so much of it. Okay, now proteins. There is virtually very little microcosm of protein. Okay, there's an iota of protein in what? Aqueous humor. And this is made up of what? Globulins and not plasma. Sometimes some of these proteins are found in form of what? Hyaluronidase, carbonic anhydrase, and lysozyme. What does hyaluronidase do? It increases aqueous outflow to decrease the pressure in the eye. Carbonic anhydrase is an enzyme whose presence increases production of what? Aqueous humor. And it is found around the ciliary body, is found around the epithelium of the ciliary body, iris, and other structures. The third and the last but not the least particle of protein is known as what? Lysozyme. As we learned, the third form is rich in lysozyme. And so the aqueous humor too is what? Rich in lysozyme. What does it do? Lysozyme has what? Antibacterial property, preventing infection. Okay, so apart from what I've told you about, there's what? Growth modulatory factors within the aqueous. Said that if your immune system is good and you develop a growth, a tumor on the iris, on other parts of the intraocular structure, ciliary body, the growth modulatory factors, okay, will help so that this tumor does not grow so much. They will inhibit its growth. In other words, they are what? Protective. There are so many of them, but they are not for your consumption. Okay, but let me just mention a few of them. Transforming growth factor, acidic and basic fibroblastic factor, insulin-like growth factor, insular growth factor binding proteins, vascular endothelial growth factor, and then transferrin. Okay, you don't need to know all these. Anyway, other substance that we found in the aqueous humor is what? Oxygen and carbon dioxide. Okay, very important. So at this stage, I want to bring my lecture to an end. But remember that aqueous humor is so important in the eyeball and you need to know about it. Apart from maintaining nutrition of the avascular structures in the eye, it maintains the volume and the structure and the shape of the eyeball. Okay, and it has optical property because about 99.9% is water, and it is so transparent that it's able to focus and transmit light onto the retina, thereby having what? visual acuity property. Okay, so at this juncture, learn hard. When we meet in class, put down some questions which I can address. So see you.